So this is chapter 17. After completing this chapter, you should be able to list examples of how nursing interventions and nursing outcome classifications can be used to implement care. Use cognitive, interpersonal, technical, ethical, legal, and QSE and competencies to implement a plan of nursing care. Use the 8 implementation guidelines provided in the chapter. Describe 6 variables that influence the way a care plan is implemented. Use ongoing data collection to determine how to safely and effectively implement a plan of care. Explain why reassessment after nursing intervention is important, and discuss what to do if patient does not cooperate with the care plan. Also describe the risk and responsibilities of delegating nursing interventions. So some things you should know about the implementation step of the nursing process. During the implementing the step of the nursing process, nursing actions planned in the previous step are carried out. The purpose of implementation is to help the patient achieve valued health outcomes, promote health, prevent disease, illness, restore health, and facilitate coping with altered function. In all nurse-patient interactions, the nurse is concerned with the patient's response to health and illness and the patient's ability to meet the basic human needs. While other healthcare professionals focus on the selected aspects of the patient's treatment regimen, nurses are concerned with how the patient is responding to the plan of care in general. One of the nurse's major contributions to the healthcare team is the role of coordinator. Remember Alfaro's rule: assess, reassess, revise, record. Assess patients before performing nursing actions. Reassess them to determine their responses after you perform nursing actions. Revise your approach as indicated. Record patient responses and any changes you made to the plan of care. When nurses certainly need knowledge of best practice interventions and technical skills to implement the plan of care, it is also true that the nurse's interpersonal competence to a large degree determines how successfully the plan is implemented. If your patients and team do not trust you, it will be difficult to motivate everyone's best efforts toward achieving the goals. There are independent, dependent, and interdependent nursing actions. When carrying out the plan of care, nurses use specialized abilities to determine the patient's new or continuing need for nursing assistance, promote self-care, and assist the patient to achieve valued outcomes. To implement the plan of nursing care, nurses need blended intellectual or actual interpersonal, technical, and ethical legal competencies, as well as mastery of the quality and safety education for nurses' competencies. Successful implementation of the plan of care requires a high degree of organization and efficiency in today's hectic healthcare environment. Pay special attention to the patient's family and visitors, as well as your institution's equipment, environment, and personnel. Although most people can independently meet their basic health needs, illness and the stress of diagnostic and therapeutic measures may interfere with the person's usual practice of self-care. The nurse assesses the patient's ability to meet his or her human needs independently. If the plan of care is well constructed, carrying out its orders is the nurse's most important task and should receive top priority. Nurses concerned about improving the quality of nursing care use nursing research findings to enhance their nursing practice. Reading professional nursing journals and attending continuing education workshops and conferences are excellent ways to learn about new strategies that have proved effective. To practice good nursing, be knowledgeable about the laws and regulations that affect healthcare and the ethical dimensions of the clinical practice. An important nursing intervention is ongoing data collection. In every patient encounter, be sensitive to both subtle and dramatic changes in the patient's condition. Skilled nurses will monitor the patient's response to planned interventions to determine if the plan of care is working. These assessment findings are used to update and revise the plan of care. Remembering the legal truth: if it wasn't done, it wasn't documented, Each nurse carefully documents all nursing interventions. When a patient does not follow the plan of care despite your best efforts, it's time to reassess the strategy. The first objective is to identify why the patient is not following the therapy. One possibility is that the plan of care may not be right for this patient. Never has it been more important for nurses to critically identify which nursing interventions require professional nurses and which can be safely delegated. Never attempt to perform interventions beyond your capacity without supervision, even if instructed to do so by a staff nurse. It's difficult for nurses to be sincerely attentive to patient needs if their own human needs are not met. Because no one is perfectly healthy or whole all the time, it's important that nurses prepare themselves for professional practice and spend time getting to know themselves. As you begin to develop your experience in implementing the plan of care, reflect on your experiences, successes, and failures in order to improve your practice. How can you do it better next time? And what did you learn today that might be able to help you tomorrow? So, why do we implement? Well, here's the major reasons. It helps the patient achieve those valued health outcomes. It helps us promote health. It helps prevent disease and illness. And it restores health. It also helps the patient facilitate coping with that altered level of functioning. So during this implementation step of the nursing process, the evidence-based nursing actions that were planned in the previous step are now going to be carried out. And so these implementation steps are going to help the patient achieve these valued health outcomes through health promotion, prevention of disease and illness, restoration of health, and facilitating that coping with that altered level of functioning. So the care plan is best implemented when patients who are able and willing to participate have maximum opportunities to engage in self-care, and they do so. Family members and other supportive people, as well as healthcare professionals, may also be involved in successfully implementing the care plan. So, as you implement the care plan, you're constantly engaging in this clinical reasoning about what you're doing. Because your patient's condition can dramatically change in minutes, you have to constantly reassess the patient for changes in the status that may dictate a different set of interventions. You also want to make sure that research supports the interventions you selected and be open to other ways of addressing patient problems and issues. And you're also going to use clinical inquiry. This is the ongoing process of questioning and evaluating the practice and advancing informed practices. In every clinical setting, we have to actively question whether or not there are better ways to achieve the desired patient outcomes. Am I giving everything or offering everything to the patient that is currently available to achieve the best outcome? And then finally, you're always monitoring the patient and their response to the interventions so that you may modify the care plan as needed. And then you want to remember Alfaro's rule. So Alfaro's rule is assess, reassess, revise, and record. So we assess patients before we perform a nursing action. We reassess them after performing the nursing action to determine their response to that action. We may have to revise our approach if indicated. Sometimes our first approach works, so that's not an always. Record the patient's response and any changes that you made to the care plan. Always ask if you are competent to implement the care plan. So this is what you're asking of yourself. Read the care plan. Look at the care plan. Do I have the cognitive, the interpersonal, the technical competencies that are required to successfully implement these interventions that are listed in the care plan? If I don't, then it's my responsibility to get help. Okay, and that actually says that I'm committed to this patient because I understand that I might not have the knowledge I need right now to implement all these things, but I do have the clinical sense. I do have the clinical reasoning to ask for additional help. And as I learn these additional practices, I will master these clinical skills. And then one day I'll be on the other end of that stick. I'll be the one providing that clinical assistance to someone who's not quite as seasoned as I am. So, even though we do things autonomously as a nurse, it's not really a solo activity. We always work with our patients, our families, the community, other nurses, other healthcare facilities. And we need to know what the best practices are, what the best interventions are, uh, what kind of technical skills will we need to implement this care. So, our competency to a large degree determines how successfully that plan is going to be implemented. So, if your team or your patients don't trust you, it'll be difficult to motivate everyone else to put their best effort forward towards achieving those goals. So, your ability in itself to communicate, listen, speak, and write effectively with the patients, the families, other workers that are not licensed, other professionals will make the difference between a competent, efficient care or care that is sloppy, unprofessional, and prone to errors. Um, Sometimes you can actually talk to your patients and find out from them like what are the qualities and attributes that they value in a nurse, and this will help you discover things about yourself. It will also help you learn how to respect, be empathetic, be more compassionate, more compatible, and to develop this trustworthy relationship with your patients. So you'll want to act in partnership with your patient and the family. Before implementing action, make sure that you reassess the patient and determine that the action is still needed. Make sure you check to ensure that the nursing interventions selected are consistent with standards of care and within the ethical and legal guidelines to practice. Talk to the patient. Approach them in a competent and caring way. Modify nursing interventions according to their background. So again, we're talking about their developmental and their psychosocial levels. What's going on with the patient? How well and ready are they to learn? What's their ability and willingness to participate in the care plan? And what are the actual responses to previous nursing measures and progress towards the goal or the outcome achievement? So there are different types of nursing interventions. The nursing interventions classification defines a nursing intervention as any treatment based upon clinical judgment and knowledge that a nurse performs to enhance patient or client outcomes. Direct care intervention is a treatment performed through interaction with the patient. Direct care interventions include both physical and psychosocial nursing actions and include laying on of hands actions and those that are more supportive and counseling in nature. Indirect care intervention is a treatment performed away from the patient but on behalf of the patient or group of patients. And interventions include nursing actions aimed at management of the patient care environment and interdisciplinary collaboration. These actions support the effectiveness of the direct care intervention. A community intervention or a public health intervention is targeted to promote and preserve the health of populations. Community interventions emphasize the health promotion, health maintenance, and disease prevention of populations and include strategies to address social and political climates in which the population resides. And then there are also things known as independent and collaborative interventions. So when you carry out interventions that are identified in the care plan, you are implementing the care plan. When you implement the care plan, you are functioning independently and collaboratively. So, just to reiterate the three types of nursing interventions, um, let's say we have a toddler with GI symptoms and delayed growth and development. If the healthcare provider orders a series of GI studies, the nurse's responsibility is to prepare the patient by executing the doctor's orders for cleansing the bowel. This would be a doctor's order or a physician's order initiated intervention because he gave you an order to prepare the patient, and the order was to cleanse the bowel, and the nurse followed that. When the nurse senses or feels that the grandmother of the patient seems unusually fearful of the outcome of the studies and therapeutically speaks and explores the grandmother's fears and then follows up with teaching and counseling, she's using an nurse initiated intervention. So this would be something that would be actually built into the nursing care plan. When a multidisciplinary team conference is held to talk about the patient's failure to progress, then the nurse works collaboratively with the psychiatrist, the GI specialist, the social worker, and the child development team, and they come up with a comprehensive plan, and this is called a collaborative nursing intervention. So if we look at this question, which of the following nursing interventions is an indirect care intervention? Okay, and we talked about indirect care interventions, and I said that an indirect care intervention is a treatment performed away from the patient but on behalf of the patient or group of patients. So, a nurse explains available birth control measures to a young couple. A nurse meets with the collaborative care team to plan nursing measures for a patient. A nurse prays with the patient. Prior to surgery, a nurse administers pain medication to a patient with end-stage renal cancer. Which one of these would be indirect care intervention? Okay, you should have selected B. A nurse meets with the collaborative care team to plan nursing measures for a patient. An indirect care intervention is treatment performed away from the patient on behalf of the patient or group of patients, such as in the example in answer B, consulting with the collaborative team. The remaining answer options are direct care interventions or treatment performed through interaction with the patient. So when carrying out that plan of care, you're going to use specialized abilities. One, to determine the patient's new or continuing need for nursing assistance. Two, to promote care. Three, to assist the patient to achieve valued health outcome. Nurses must organize necessary resources and anticipate unexpected outcomes and situations. Novice nurses have to be sure that they possess the nursing competency to carry out the care plan and to consult with their instructor or mentor if they're unsure of their knowledge or their technical abilities. So while we're implementing these plans, remember that we're taking into consideration the patient's developmental age and psychosocial background, their ability and willingness to participate in the plan of care, their response to the nursing measure, and their progress towards the goal achievement, as well as making sure that we're implementing those standards of nursing care, that we've done our nursing research to ensure that it supports our plan of care, and that we fall within the ethical and legal guidelines. Also, do we have the available resources, the staff, the equipment, the supplies to carry out this plan of care? And do we have creativity and repertoire of the nursing measures that we want the other nurses to make sure that they carry out when we're not present? So we determine the patient's new or continuing need for assistance, promote that self-care, assist the patient to achieve those valued health outcomes, reassess the patient, review the plan of care, anticipate unexpected outcomes or situations, prevent errors and omissions, assist the patient to meet outcomes, and clarify any questionable orders. So ideally, the patient is primarily how we determine what nursing interventions are going to be implemented. We know that the plan has to be modified, and it's going to be modified according to the patient's ability to change, their willingness to participate, previous responses that we've seen to nursing interventions, and progress towards achieving those goals and outcomes. And other factors that would fall in would be the developmental stage, the psychosocial background, and the patient's culture. What kind of variables will the nurse herself face? So, factors that might influence the implementation of the care plan may include the nurse's level of expertise, her ability to be creative with the nursing plan, the willingness for that nurse to provide care, and the availability of time. So sometimes that may depend on what, staffing and other things that are going on. What are the current standards of care? So when you implement the care plan, it has to be consistent with the current standards of practice. All nurses are responsible for learning the standards that dictate practice in their specialty, and failure to do so could result in a charge of negligence for that nurse. Research findings. Nurses should be concerned about improving the quality of nursing care and using current evidence-based practice to enhance and support not only the care plan, but their nursing practice in general. So you have to constantly be reading, doing that continuing education so that you can be up to date on what the new standards are. You also need to be familiar with the ethical and legal guidelines that affect your license and how you perform care. To practice good nursing, you have to be knowledgeable about laws and regulations that affect healthcare and the ethical dimensions of the clinical practice. Without this understanding, a sincere motivation to benefit the patient and conscientious attempts to implement nursing orders will not be enough. Each nurse is responsible for becoming sensitive to the ethical and legal dimensions of the practice. Moral and legal accountability are inherent when you practice nursing. Which example illustrates a nurse variable influencing the patient outcome? A patient in a nursing home refuses to take his medications. B, a low-income family is unable to afford formula for their newborn infant. C, an alcoholic patient is willing to accept AA meetings. Or D, a rape victim does not receive counseling in the emergency department because a counselor is not available. So which one of these illustrates a nurse variable influencing patient outcomes? So if you selected D, you were correct. A rape victim does not receive counseling in the emergency department because a counselor is not available. Nurse variables that influence the care plan include resources, which would be answer D. Current standards of care, research findings, ethical and legal guides to practice. The remaining answers are patient variables, which includes the patient's changing ability, willingness to participate in the care plan, and personal responses to the nursing interventions implemented. So common reasons for noncompliance would be a lack of familial support. So let's say, for instance, we had a patient that was a diabetic, and they're supposed to be following this strict diabetic diet, but in the house every night, family is cooking all this other food that really doesn't support the diet, and it makes it very difficult for the patient to be compliant because they're smelling all these great flavorful foods and they want to eat them. Another example, this could be a girl, a young, teenage girl that is maybe anorexic. And maybe she's anorexic because her mom is pushing her towards, oh, you have to be skinny. I need you to be on the cheerleading team. And the mom's kind of pushing like her desires from what she wanted to be when she was a teenager into this young girl. And so the young girl is stressed out and she's anorexic because she's trying to meet these expectations of the mom. Also, lack of understanding about the benefits. So the client doesn't maybe understand what or how that the doing these interventions is going to improve their health. And that could be for a variety of reasons. Maybe developmentally, they don't understand. They might not have that level of education, or someone just never taught them and they never took the time to learn. They have a low value attached to the outcome. So for them, they don't believe that the outcome is going to benefit them in any way. They don't value it. They have no belief in it, or a poor attitude towards it. And this could be related to cultural environments and lack of understanding. It could be for a variety of reasons. Maybe they're averse to the physical or emotional effects of the treatment itself. And that kind of speaks for itself. So, sometimes medications, people don't want to take certain medications. Why? Because the medication might make them feel with some sort of side effects or whatever. And so they don't want to take the medication because they don't like the side effects. All right. Inability to afford treatment. So this is huge. We still have a lot of disparities in the healthcare field, and sometimes patients just can't afford or don't have access to the treatment or to where they need to go to get the treatment. So that can certainly affect the patient's ability to receive treatment or to go and get it. Okay, now we're going to talk a little bit about delegation, all right? Because you're going to be a RN now, and at some point you'll be a charge nurse, and you're going to have all these increasing demands for services falling upon your back. You're going to have to make sure that all the nursing care that needs to get done in that shift is done. And sometimes, or most of the time, the only way to do that is by delegating tasks out to different people. But you can't just delegate a task. There are certain rules you have to follow. You're going to be delegating to stuff to sometimes people who don't have a license, known as unlicensed assistive personnel, and sometimes you'll be delegating to staff nurses or LPNs. Okay, understanding what the rules and regulations are will help you do that safely. So delegation itself is the transfer of responsibility for the performance of an activity to another person while you still maintain the accountability for that outcome. So you have to be sure you're following the rules, because otherwise it could threaten your license, but more importantly, patient safety. So what are we delegating? The right task, okay? So in order for us to delegate the right task, what does that mean? The right task is a task that falls within the person that you're delegating its to job description. And there's generally a written policy and procedure that covers that task. The facility is responsible for making sure that the task falls within the delegatee's experience and knowledge base and expectations and all. And then they would also provide any competence training that was needed. And in that policy, they would list limits or limitations on the delegatee's job description, so that way they didn't perform something outside of their scope of practice. Okay, the right circumstance. So the patient has to be stable in order for you to delegate that task. If the condition changes, then the delegatee would be responsible for communicating that to you. And you should probably make sure that the delegatee is aware of what the abnormals are, so that they can report it to you, because they may not be aware of that. So you would want to make sure that. Okay, and that the licensed nurse knows and understands that if the condition of the patient changed from stable to unstable, she's responsible for going back and reassessing the situation and then redetermining should that delegatee be there. Is this still within their scope of practice? All right, and then the right person. All right, so you know that you have to assign the right person, the person that has the appropriate skills and knowledge to perform the activity. That's who you have to delegate it to. You also have to provide clear-cut directions and communication. Each situation should be specific to the patient, to the nurse, and to the delegatee. All right, the licensed nurse has to communicate specific instructions for the delegatee activity. All right, as part of a two-way communication, the delegatee should also ask clarifying questions. So if you're saying, okay, yes, you can take the patient in room 5's blood pressure, but I need to know if the diastolic is above 95 and if the systolic is above 135. I need to know that. So please communicate to me. This way you're giving them clear-cut, specific instructions. You can't just say, go take their blood pressure and tell me if it's abnormal. You have to give them parameters there. They have to completely understand the terms, and they have to agree to accept that delegated activity as well. And then you ensure that they understand that they can't make any decisions or modify any directions that they gave you, that you gave them, without seeking your permission first, okay, and your input first. And then the right supervision and evaluation. So you have to go back and monitor that activity, make sure it was done within the time frame that you wanted to be done, make sure it was done appropriately, and all those good things. And then you're evaluating the patient's outcome. The delegatee would be responsible for communicating patient information during the situation where they provided that care, and you should be ready to and available to intervene if needed. You should also assure that appropriate documentation is done after the activity has been completed.